3.
Okay.
Okay. It's hormone positive, estrogen receptor positive, and progesterone receptor positive. Before my time, there used to be one type of breast cancer, and it was called breast cancer. But now we've gotten so smart, and we've learned about all these different types of breast cancer. So that's why I write down this. If you ever went online or reading about breast cancer, they're going to ask you, do you have hormone positive breast cancer? And is your breast cancer mutated? And yours is not mutated.
Okay.
HER2 not mutated. So that's what kind of breast cancer you have. Yes. Now this is a mutation in breast cancer cells. Dr. Habal did a mutation testing for your germline mutations. That means mutations in cells, all the cells in your body, and you did have a mutation in something called POLD1, and that's a mutation that all of your body cells have, and that was inherited from your parents. Okay, that's different from this mutation, which we only look at in cancer cells. Okay, so because it's a stage 3, generally we do chemotherapy. So this is our to-do list. Is going to be CT of the chest, abdomen, pelvis, and bone scan, and labs. Are you having any headaches, blurry vision, weakness in one place? So I won't do an MRI of the brain. So CT, labs, and then a heart ultrasound. It's called an echocardiogram. The reason I do this is because if this is all negative, then I would recommend chemotherapy for you, and the best chemotherapy includes something called adriamycin. Adriamycin is one of the very first chemotherapy drugs we ever used, and we used to treat all different types of cancer with adriamycin, and we used it at very high doses, and it caused people to have heart failure. So we don't do that anymore, but because of its dirty history, we always check heart ultrasound before and after treatment with adriamycin. So the reason I'm checking this is to see if you would be a good candidate for that drug. Let's see. The other thing is, if all this is negative, then for chemotherapy, you would need a port. And Dr. Habal can place that. It's a surgical procedure. It takes 30 minutes. They go in, make an incision in the chest, and put a button in there that's connected to a large vein. They sew it up so nothing hangs out on the outside. And that just helps us deliver chemotherapy easily and safely, more comfortable for you. Okay.
And this is over a period of time?
Chemotherapy? Yeah, I'm going to talk about that next. So after you'll come back, we're going to have all these studies done. You'll come back, and we're going to pray that all these things are negative and we don't have metastatic cancer. If that's the case, and your echo is normal, then what I normally treat people with is something called dose-dense AC, and that's every 2 weeks. So you come in one day every 2 weeks times 4 cycles. So that's 8 weeks of chemo there. And that's followed by a weekly Taxol. So you come in once a week then for the second part. And that's for 12 weeks. So we're looking at 5 months of chemo. After that, you'll have radiation. And you'll only have it on the right side because the left side was a stage 0 breast cancer. And you had a total mastectomy there, so you won't need radiation on the left, but you will need on the right. And then after that's done, we'll do anti-estrogen therapy, which is a pill. It's a pill for 5 years. And this will prevent recurrence of your stage 0 breast cancer and your stage 3 breast cancer. Okay, so let's talk about everything comes with a price, right? What is the toxicity of this? So we talk about heart failure. So that's rare, okay? But we follow the heart pump. Drop in blood counts. Okay, so you'll see me, before each treatment, we check your blood work. We make sure that you don't need a blood transfusion or platelet transfusion, that sort of thing. Hair falls out no matter what treatment I give you for breast cancer. Okay, nausea and vomiting. I will say this, we've gotten really good at treating that, so that's rarely a problem for people, but I do give you a handful. You'll have a pharmacy at home, basically, with all that stuff to prevent, okay? So I'll prevent that with medicines. those are the biggest side effects here. And you're gonna spend an hour with the chemo nurse once we get all of our ducks in a row, but this is just your overview, okay?
Mhm.
Taxol can cause neuropathy is the biggest problem. And this is dose dependent, so you'll get sick of us asking you, but we'll ask about neuropathy, which is numbness, tingling, burning, loss of sensation in the hands and feet.
Okay.
And I can reduce your dose or give you breaks in between to get through that.
Okay.
And then things that are annoying like nosebleeds and stuff like that. We'll teach you how to manage that. So
Okay.
that's our big picture plan. Okay, we're looking at 6.5, 7 months probably of intensive treatments, and then you'll be on a pill and you'll see me, every 3 months for a while. Okay. What questions do you have? Yes.
She sees the radiation doctor on the 4th, so the radiation doesn't start until after this is done?
Correct. But you should still see him, and you'll get plugged in. He'll kind of do a big overview kind of visit like you're doing with me right now.
Okay.
Radiation will be like Monday through Friday, 15-minute for maybe 6 weeks.
What kind of care at home is she going to need?
Do you live by yourself?
She
I
does.
do.
Oh, okay. Do you have anyone live close to you?
Mhm.
You're across the street. Okay, then you could probably continue to live by yourself if you have someone across the street. But things like for these first like 8 weeks, you're gonna be very tired. You're gonna be vulnerable to infection. So things like if you can avoid going to the gas station, the grocery store, and have someone help with that sort of thing, just so you're not around. As you know, you've got bronchitis. As you know, it's that time of year, and being on chemotherapy right now, it's just tougher than if you were doing it in the summer, just because there's more viruses and things like that. So,
Okay.
the first 8
In
weeks.
other words, the Greens cubes can stay home.
Yeah, and for sure.
No.
Just for this first 8 weeks. After, when you're on the Taxol, you'll be tired. Your hair won't come back till all this is done. But besides that, you're gonna be, back on your feet again. I would recommend getting if you do work still.
No,
Okay.
I have given it.
Okay, all right.
After 50 years.
Yeah, I think
give
it's
it up.
time. Okay, good.
Yes, I do.
This is a fine time to do it then, so that gives us flexibility. For the treatments, how far is LaGrange? Remind me.
Maybe 45 minutes.
You might want to have someone come with you for your treatments, at least the first couple, because we do give you pre-meds beforehand. Some things include Benadryl, and it can make you sleepy. And I don't want you to have to drive home whenever you're feeling loopy, that kind of thing. But there's otherwise, besides like that chemo day, and if you're feeling fine, there's no reason that you couldn't continue to drive, go to church, that sort of thing.
Okay.
What else? You'll just be tired, but I've got women your age or older who just breeze through it. And then I have 30-year-olds who don't breeze through it. So I never know until we get started. And all of this stuff, you're going to see me very frequently. We're going to make adjustments if we need to. And you'll be fine.
When does this start?
As soon as we get, we need to get, today's only Wednesday, so I don't see why we couldn't get all of your imaging and labs and things done this week and potentially start as soon as the port is placed. So let's get scans and stuff, let you come in and see me early next week. We'll go over the results and the final treatment recommendations, because what I've given you now is sort of a tentative plan. We'll go over the results of the scans and make sure that's all fine. I'll refer you back to Dr. Habal for your port, and the same day you get your port placed, you can come for chemo. So generally within 2 weeks.
Good.
Okay? So enjoy Thanksgiving, fill up, and we'll get started after that probably. Okay? What other questions do you have for me?
And y'all can figure out who's where.
Do you still have drains in place? Drains
No,
from them?
they
Okay,
have
they're
took
out.
them
She
out.
was a happy camper last
Okay,
night.
yeah.
Yeah, they took them out
Okay,
Friday,
good.
and there's not even been any drainage
Okay,
run
perfect.
down.
Perfect. About 6 weeks after surgery, we can talk about like breast prostheses and the.
Well, I already
Ross.
have one on.
Oh, you already have it on? Okay, well, good. So you're ahead of the game. What else? Well, do you mind if I examine you?
No. I mean,
Okay, do you-
it's fine.
Yeah, well, come over here for me.
Okay.
Let me hold that closer.